Hi, I'm Hans. I'm going to talk about core stabilisation. What we have to assess first is the function of the diaphragm. The diaphragm is the ignored key to proper core stabilisation. What we need to see for proper diaphragm activation, we want to see that when we breathe in, those lower ribs don't move upwards. We want to have a nice lateral expansion. So I'm going to put my fingers in there. That's going to ask, just take a deep breath in, not too deep, just breathe in and out. And again, and I feel the space is separate and it's all moving sideways out like this. I also want some activation on the abdominal wall. Then if you get you to lie down on your back, and in a similar fashion, we just check the rib cage and try to get that lateral expansion sideways. We don't want to have any upward movement like this, which is a faulty breathing pattern. As soon as people breathe the wrong way, they tend to migrate upwards, stomach goes inwards, and just overloading everything up here and leaving the spine completely unprotected. One help in this is to make sure that they have to come down a little bit. We get back to that later. After we have ensured that we got the right diaphragm pattern, we're going to then try to move that breath, pushing further and further down into the abdominal cavity. So we're going to make sure we're going to put the finger down there. It's going to ask you, can you just breathe in and try to breathe in through my fingers. So when you breathe in, you push out against my fingers all the way down. Deep as you can. Breathe in. Now we know that he can create the pressure in front of the lower spine. The secret now is the next step, and that is to be able to maintain that pressure when he breathes out again. So we're going to ask Felix that you breathe in, hold that now when you breathe out, hold that pressure, good, hold it, good. And that's sort of the level where you start to practice. So the next step, if you can take a fair band and just put it around the bottom ribs, and then get him to take a deep breath in or breathe in and try to expand the bottom of the rib cage. We want expansion sideways, backwards and slightly forward. So the whole rib cage, good. Yep. And of course we can do the same thing in a sitting position. Get the band around the ribs and try to breathe. Excellent. In this position, we do the same as before. Get you to breathe in, hit all the way down to the bottom. Breathe every breath, push against. And then again you breathe in, hold that when you breathe out. Hold it, hold it, hold it. Brace yourself, nice. Good. The next thing we start to do is to challenge this system with additional resistance, and we get him to carry the weight of his legs. While maintaining that, we look for the concavities, make sure that they're not there, chest stays down, all through the breathing cycle. We can also put the legs down, relax. Hold that and take your arms and bring them up while you're maintaining that. So we're looking there, we're looking here, get the arms up and down, good. And then of course we combine the two and do both. Brace yourself, hold that, and then move your arms. I can also apply resistance, but I would push your legs slightly to the side, might pull your arm. I can tip you sideways and you try to hold that, hold it. Hold yourself braced. You should be able to stay in that position without any effort. You can also bring the legs up towards me against resistance. Bring these legs up. Good. You can do alternatives. Just really anything just to challenge this, but pay attention to the concavities and to the chest position. Arms up against the wall. Hold that. And this is a DNS version of the dead bug. And what we're looking for again is slight pressure up there. Look at, make sure that's all braced, that we haven't got the concavities, chest is in a good position, and then just move your arms and legs a little bit. You have to do alternates a little bit like this, and push that way and keep yourself nice and braced while you're breathing normally. That's the secret, to make sure that that does not, because that means just the rectus is kicking in. Good.